Hello and welcome. Today, this is Dr. Kashyap. I'm presenting this particular topic on behalf of Dr. Nawaz. This is about how to come up with a research idea or research ideation. Uh, Dr. Nawaz is world-class speaker on this one to give these talks, and then we are recording today, so you can watch it later on. Um, Many of the time when people have not done research or scholars they have not done research, they ask about how to come up with an idea. I have never done it, and you're asking me to come up with an idea. So let's share some of the things you can come up with for that matter. The objective for next 15-20 minutes is to approach to research ideas, do's and don'ts, what you should do when you're looking for research ideas, and what you should not do when you're looking for research ideas. We'll give you some publish ideas and you can take some of it as well, and then in the end we'll open up for discussion as we go through. So this quote is favorite by Dr. Nawaz. It says that if we knew what we are doing, it wouldn't be called research, right? So this is whatever you do with in the first project. It might be repetition of a different idea, and we'll go into that detail, maybe fine tuning that idea a little bit more further as well. And research is all about you don't know the result, what it's going to look like already. That's why it's novel, and then it is exciting because you'll be adding to the literature for that matter. So in this next slide, what I'm going to do is what he has shared with us is that where the research ideas come from. First and foremost, if you are a medical student or a resident or a fellow or faculty member, most of these research idea comes from your clinical setting. You may get a chance to see a patient. It was unique for that matter, or maybe your physician or mentor was talking about something, or you got exposed to something by your seniors or other medical students and residents in your time as well. So then look for those ideas in this regard. Especially pay attention to the specialty you want to go into. Second thing is, if you're not reading already, going through the existing literature, just scrolling through the PubMed, Google Scholar, ResearchGate, ideas you have some in mind, or at least the specialty areas, or you can type in those who use generative AI, Chat GPT. You can type in what are the top most ideas for clinical research in medicine. Understanding that some of the GPT versions are older, they don't go beyond 2022 and things like that. Or you can use Bard AI or Bing AI and things like that, and that can help you generate some ideas. And then again, some of those ideas could be so generic, that so futuristic that you can't do practically anything else. So you have to apply your brain when you're even doing some search. But looking through existing literature will definitely give an idea that okay, they have done these things. Maybe I can do something similar on the topic I'm interested in and things like that. Scholarly discussions like we are having today. Dr. Dev presented right before us. You were listening and talking to a conference in your medical school, or anything you listen online. There's some online free webinars you're listening in, and then say, this is the knowledge gap. Nobody has done it. You can write a review or scoping article on that particular topic if they are identified for that matter. Society you live in, you may see things around you, maybe a social project, maybe a global health project, maybe a women empowerment health project, something you're looking into, maybe a project on poverty, homelessness, project of opioid crisis, anything which you see in a society could be a research project. It has to be associated with medical field, so then you can take credit when you time comes for applying for residency and so on and so forth. Sometimes personal experience, you or your family members have suffered with certain disease, or you have seen somebody with close quarters, and then you can use that and say, maybe I want to know more about this particular thing or some type of this particular thing, and let me see what has been published, and then you can come up with a research idea for that matter. Or you may have a previous project which is unfinished, or something you started and never finished it, or something you always wanted to do it and then you could not get enough mentoring as well. You can always bring up those ideas as well, and then see we can build it up for that matter. This is an initial place to start with, where the research ideas could come in. Okay. What is the process for research ideas and things like that? You can start thinking of a bigger thing, like, okay, theme. What ideas I want to go into? You want to go into cardiology, and then go into further research question, picking up a disease or entity, and then say that what is a research question. Hey, I gave always all the time give an example is like, does smoking cause lung cancer? And that's like, that's my research question. I want to think about pulmonary or lung area, and then it's smoking and lung cancer, and that was my research question. And then you can pick up a topic that is smoking among XYZ patient would cause lung cancer, or people who smoke and do the coffee drinking have more chances of lung cancer or GI cancer for that matter. That's where you can pick and choose the area, themes, your research question, and the actual research topic you want to do it as well. Your research topic question will not be perfect from the beginning, so always have a loose and then start reading about, and we'll have some videos for you to how to refine your hypothesis, how to refine your aim. Your goal is to come up with 2 or 3 ideas, and then we can help turn them into your research themes, research questions, or research topic for that matter. But think systematically. You can't be, and it could be totally 3 different topics. It doesn't have to be exact same topic. You can pick one from certain area, one from different area, and things like that as you go through. So what are the steps? Steps for brainstorming these things. The first thing is you look into literature. You look into different sources, PubMed, Google Scholar. Some of you might have already known about these things. We may go a little bit detail in the next slide. WHO news report. I get a lot of ideas from WHO. I sign up for some of these free webinars and things like that. You can look into anything which gives you an idea. Maybe you're working in an institution. Maybe you are a part of an information coming out, and maybe looking for current affairs for that matter. Monkeypox is going on right now in Nigeria and other places, in Ghana for that matter. So you can always pay attention to current affairs, read a little bit about them, find the gap. Like they have published this part, maybe we can add something around it as well, and do a search. There's a pretty good chance somebody might have done some research, not in the part of your country you live in, or the way you wanted to ask that question. Then we go into deals with PICO framework. Dr. Mehta teaches the PICO framework quite a bit, and probably will bring it up in future for you. I think second or third lecture will be on that part. Maybe next week we can talk about it. PICO stands for what population you're targeting. If your research is systematic review meta-analysis, what kind of intervention or exposure group you're looking for, and what's your comparison group. C stands for comparison, and what is the outcome you're looking into. So, one example would be in outpatient clinic or pulmonary clinic, you're looking for a smoker as an intervention, non-smoker as an exposure group, and lung cancer incidence as the outcome. That's a very simple PICO. Most of your question will be more complicated than that, but that's to give you an example of PICO. Then you build your research question, and then you can refine it after reading. You can build it, refine it, show the third version, second, fourth version, and then we'll help you refine it as well. So this is the process we want you to go now next week by the time you come back, and then each of you should be able to submit 1 or 2 questions. We'll pick up 1 question. You can have up to 3. Each of you will get a chance to present at least 1 question as we go through. So step 1 would be going to PubMed. That's where the PubMed look like. It's a free link. You can go to PubMed, search the types name, people's name, if you want to follow it, and Google Scholar. If you have not published, it's hard for you to make a Google Scholar profile, but you can go and search on Google Scholar, different topics, different authors, and so on and so forth for that matter. Then goal is to find the research gap. That's main area is that, where you find the research gap. There are places you can there in these areas. You can look into PubMed, Google Scholar, or just simple Google, or any search engine you use for as well. You can put some key terms. You are motivated about these issues. You can put down those issues. Use the key terms. Use the or and and function. Or functions are for synonymizing things, and functions are to combine those 2 things. If you use or functions, that expands your search. If you use and function, that constricts your search, because now if you're putting Swapna and Shivanjali, it'll only show papers with Swapna and Shivanjali both being a co-author. If you say only Swapna, it'll only gonna say all co-authors with name with Swapna. Once you add things, they will be constricting as well. You can look into that. There are some things are not addressed in the literature. And then sometime when you're reading papers, read their future direction sections. When they say, oh, the future direction is that somebody should look into this area, that section can give you some ideas for research if you like the particular topic, clinical trial, and then say that they are talking about it. And then we go into detail that would it be a scoping review, narrative review, a case case series, or a systematic review, or a book chapter. We can decide those things based on the hard work you do, and you find out to us, and then we will be able to tell you all those things once you identify the research gap. The most effort should be identifying the research gap, And a good question, when I say good question, is you've done enough research and then you are defending that why you want to do that particular research, and then we will be able to tell you, that's a pretty good thing. Sometimes we'll tell you, say, hey, I want to study about the diabetes. I was like, there are like a millions papers on diabetes. You have to be a little bit more deeper, you have to add a little bit more layers to your research, and we go from that area. Just to show you this with an example, and Dr. Mehta will take a lecture probably next week for 15 minutes. PICO stands for what patient population. You should define your question this way. Any question you come up with, if it's applicable. Intervention, control, and outcome. Example is, children is my population. I'm going to see acetaminophen compared with ibuprofen and temperature. My question is acetaminophen or ibuprofen more effective at reducing fever in children? That's it. That temperature turns into fever, and then how it's more effective, less effective. That's a very simple example. Things like that may apply to your clinical question. You may not have a comparison group. You're looking for certain things which are just a narrative review and things like that. So this will apply once you have a clinical question. Some part may not apply. Some research question may not have PICO question, but if you're going for a clinical question, I would like you to start thinking in a PICO direction, because you'll hear a lot, and we will ask you to repeat PICO every single week, even though you have finalized your research question. When you're looking into PICO, we'll introduce another term for you as a final criteria. And then final criteria stands for feasibility, interesting, novel, should ethical, and relevant. And very quickly, these are self-explanatory for you guys. When you're looking for PICO question, you run the final criteria as well, that this should be feasible. Feasible based on the subject you're picking up, the expertise you or the group of mentors have in the group as well. Is it timely? Can you finish that? You can't come up with a question for clinical trial and try to finish in 6 months. That's not going to happen, because clinical trial design can take a year and another year to get the funding. So timing part. And then if it requires a funding, if you want to collect the data prospectively, you have to go and hire people, they can collect the data, or study coordinators and things like that. Is it interesting? We will not let you pick up a boring topic, but if you're not enthusiastic about the topic, then your teammates will not be enthusiastic about it. So picking up a topic which is interested to yourself, to public, to the patients, to the healthcare in general. So that is another part. You have to say, this is an interesting topic, I want to pick it up for that matter. Is it novel enough? Again, we said that this cannot be a Nobel Prize winning idea, but it should have some novelty for that matter, at least in some aspects, either the length, either the amount, the criteria you're using, or location you're using. It's very hard for you to come up with a very really novel question, but try for that novelty, that you're not just picking a question and saying, this has been done in America, I'm going to do in Canada. Probably not going to fly, or things like that. If there's some underrepresented areas, let's say something in Africa or Middle East or North Africa or sub-Saharan places, they are underrepresented, then you can actually look into similar questions as well. But try to have some novelty for that matter. And should be relevant, advancing science. You cannot do a study on mermaids. You cannot do studies on aliens and things like that. However, if you're in psychiatry or well-being, there might be some areas we will encourage you as well. But make sure that these are relevant to your interest, relevant to the field you want to grow in, and relevant to mentors field as well. If you pick up something in geology, we have no expert in those areas. So try to pick up something in medicine which is relevant as of today, or relevant what direction you are going into for that matter. So current affairs is going to be very, very important for you as well if you look into it. Not that all questions should be coming out from there. Now, let's take you with some examples. And many of these examples are from our faculty members. So these examples, first one, I'll say that, Dr. Nawaz and then Dr. Deo, you just heard that when we end up doing a global survey on clinical care practices, and we end up publishing it in 2022. The survey was done in 2020 at the time, right before the pandemic started. We were able to use actually the COVID questionnaire. It got published in World Journal of Critical Care Medicine. One idea. Dr. Nawaz has published readiness of embracing artificial intelligence among medical doctors and students. It's a question-based study. And then he has done a follow-up study through MBRE students last year when we looked into LLM's survey as well. And some of you might have taken that survey as well. Then next example is he's end up looking into low birth weight prevalence in children diagnosed with neurodevelopmental disorders in Dubai. A review article, maybe they may have used the data from the hospital if you're working in, and they can use an IRB and all those things. Another one was is that comorbidities associated with attention deficit or hyperactivity disorder in children, adolescent and tertiary care hospital. Again, there's a theme coming up. He is a psychiatrist. He's getting in training. He's interested in social media. So some of these themes are coming out from there, that he's interested in some of those things and then going into that and those directions. Look into obsessive compulsive OCD in adults and in intellectual disabilities. Another paper in case reports in psychiatry, and then Miller-Fisher syndrome and as a case report from him as well. So different types of articles, some patient database related things, some review articles, some editorials, and some of those. Our own GRSP group, I think 2 batches before, they end up publishing a paper on bathtub issue related deaths. If many of you remember, the Friends Chandler Bing, Matthew Perry died in LA last year, and then before 7-8 years ago, Devi, one of the Hollywood actresses, died in Dubai in similar circumstances. And this was too enough for us, and then we end up writing, and then she ended up designing this figure by herself on iPad. It was a scholar designing the figure, and that becomes one of the prominent figure for this whole thing. End up writing a review on this particular part, and then writing it as well. The whole empowering women in health and artificial intelligence and robotics, all female authors. You would see your faculty member, Dr. Arshad, as a senior author listed there. They end up writing this editorial on Curious at the time as well. So ideas coming up, it's something you're passionate about. You can fertilize those passion in this group here, and there's no bar, there is no judgment there. You pick up any idea and you can share, and we'll make sure that it's a good idea. We will help you enhance those ideas for that matter. Other ideas of psychological aftermath after pregnancy, after infection of monkeypox. Dr. Nawaz has published that in Springer Link as well, and then respiratory health in Afghanistan. They're global projects you can look into. You don't have to be from Afghanistan, but we can always find co-authors or somebody who can bring that perspective for that matter in this regard. Hashtag analysis, you have heard a lot about it. Our group is specialized in the world, and only 1 or 2 groups like us, and we collaborate with another group which is based in Australia, who does the hashtag analysis social media. And you would see Matt Vetter, Dr. Nawaz as the first author, impact of psych Twitter, and we have, I think, 6 other projects, global health and ID Twitter, and all those things are in writing phases from previous batches as well. Dr. Nawaz, Dr. Arshad is the first author on one of them. One got published and presented in ID week last year, and those are in writing. So you can pick up these things as you're going forward, looking into those areas as well. Of course, Twitter is not called Twitter anymore, but still there are tools which can extract the hashtag analysis for you guys, and that could be a good project for you. We usually take 2 or 3 projects like that in every batch. If it is specific, and these are easily, you can finish the whole project within a month or month and a half, and you can continue working on the second of your own project for that matter. Then systematic reviews and meta-analysis. You look into Dr. Nawaz's paper where they looked into protocols for non-alcoholic fatty liver disease in children and taking atypical and psychotic medication. See how he's building his portfolio around psychiatry, because for that matter, we end up writing medical errors in intensive care unit and systematic review meta-analysis many years ago, as of today for that matter. There are other examples. One is very novel on Nobel Prize winners. Mortality and immortality among the Nobel Prize is an experiment into effect of status upon longevity. That on an average, if a person who has won a Nobel Prize, they live at least 2 years more than compared to the same other people who have not won Nobel Prize. Just it adds to longevity after taking care of everything else. So these are the idea. People have published all those things. You can study that. You can compare it with the people in the same age group, or people who were nominated did not get the Nobel Prize. If you have access to that kind of data, and you can actually publish something like that as well. These are pretty unique, and it's in Journal of Health Economics for that matter. So if we can't get Nobel Prize in the first go, we can actually study about them and then prove it that they live 1 or 2 years longer compared to a non-Nobel Prize winning people, finding a good comparison and doing a match pair analysis for that matter. So my second second half of this talk is the do's I've talked about already. Let's talk about don'ts. Avoid broader topics. Go a year, at least 1 or 2 layer deeper on a topic, so you're not on the superficial level anymore. That requires a lot of reading. Avoid repeated topics. If you study smoking and lung cancer, I will tell you probably not, unless you can tell me that I'm 4 layers deep and I'm going to ask this specific question. Same thing with diabetes, same thing with tuberculosis, and same thing with COVID-19. The appetite for article journals and editorials are very low for COVID-19, so please do not come up with a COVID-19 question unless it has not been studied at all. uh, any irrelevant to current science. If something was done in 1960s and never been done, and you got excited about it for no good reason, run it by us. Keep something which is current, which is futuristic, which is now, last 20 years, next 10 years, and so on and so forth as well. And first and foremost, do not harm. Your topic should not be something which could be controversial, which can hurt a sentiment of a country, leaders, politics, or religion. I would stay away from it. Once you grow to a level when you are associate professor, full professor, nobody, you don't care for what people make opinion about it, then you can go into some of these topics. In the early part of your career, avoid controversial topics because it's no good. It'll come back and bite you somewhere in some place as well. So goal is not to do any harm to the patient, to yourself, specifically in your career, and to the society you serve in. So just be mindful of those things, and we cannot emphasize enough on that part. Dr. Nawaz is like this quote, and it reads for you is, great leaders are not the best at everything. They find people who are best at different things and get them all on the same team. And that applies to you as a leader of your project, that you should be able to come up with an interesting idea. So then everybody jump in like, I want to help you. I want to be part of that project. And then you train them and they help you out, collect the data and things like that as well. With those words, I would like to stop sharing my screen and open up the field for questions, and then like and subscribe to our channel if you're watching this video.